Welcome to this first of two videos on cost analysis and exploratory cost effectiveness of youth-friendly sexual and reproductive health services in Moldova. My name is Jari Kempers. I'm a health economist and owner of health economics research company Qalys, based in Amsterdam in the Netherlands. If you need health economic expertise to support planning, fundraising or evaluations of healthcare programs, please get in touch with me. My contact details are at the end of this video. We have published this research in the BMC Health Services Research Journal. My co-authors are Dr. Evert Ketting and Dr. Qalys.eu. This study was implemented by Qalys in close cooperation with the Health for Youth Association of Moldova in 2013. The project was funded by UNICEF and the Swiss Agency for Development and Cooperation, SDC. Below is a link to the open access article. You can also find the link in the description of this video. So we know that you might not have time to read the article, therefore these two video presentations on the main results of the study. This first video covers the cost analysis, and the second video exploratory cost effectiveness analysis. So why this study was needed? Youth-friendly sexual and reproductive health services have high priority in many countries. Yet little is known about the actual cost and potential cost effectiveness of good quality youth-friendly health services, especially in resource-limited settings. This poses challenges for policy making, lobbying, and fundraising for the youth-friendly health services programs. How the results were used in Moldova. This information is not in a publication, yet it's quite important. In Moldova, the results were used to support the program in a number of ways. Firstly, the results were used to support lobbying and fundraising for the program. Fundraising and funding proposals become more credible and convincing if you can show how much your healthcare services actually cost and how much is needed for the program. Secondly, we demonstrate the cost of delivering good quality youth-friendly health services. This is especially important when you're operating under resource constraints. You need to be able to show and demonstrate that the good quality services are worth of the additional investment. Thirdly, the cost of providing good quality services were also used in the negotiations with the National Health Insurance Company for appropriate reimbursement levels for the services. And finally, the scale-up forecast gave a rough estimation how much funds would be required for scaling up the program to national level. So what were the objectives of this study? The main objective was to evaluate cost of good quality youth-friendly health services in Moldova. On youth-centered level, to determine how much did the youth-friendly services program cost in 4 well-performing centers in 2011. Financing sources, how the 4 centers were financed, expenses on what the 4 youth centers spent their funds, how much delivering each service cost, and how much reaching one person or one patient cost. And on a national level, to estimate how much scaling up a good quality national youth-friendly health services program would cost. Here's a short overview of methods used in costing. More details can be found in the paper. The objective was to evaluate good quality services. Therefore, 4 well-performing centers were selected out of 38 youth centers in Moldova. In this way, the cost analysis reflects resources needed for implementation of good quality youth-friendly health services. The selection was based on the following criteria. The center had been operational more than 3 years. It provides an extensive service package. It meets the quality standards and obtained a high score in the baseline evaluation in 2009. The costs were analyzed from a healthcare provider's perspective and included funding and material support from all sources in 2011. 2011 was selected because it was the closest completed financial year at the time of conducting this study. Personal salaries contribute a large part of the budget of the youth centers, and therefore a special time use survey was developed to measure how the personnel spent their working time. Here are the selected 4 centers. Firstly, the Neovita Center, the largest, and the National Center in capital Chisinau. Second, Atis Center in Palti, which is the third largest city, and two smaller, well-performing rural centers, Salve and Tineri Pentru Tineri. In the cost analysis, the youth-friendly services were grouped in the 6 main categories. Description of the services can be found in the article. Sexual and reproductive health services were grouped STI consultations, HIV consultations, and early pregnancy and contraceptive services. Other non-sexual and reproductive health services were psychological counseling and general health services. In addition, information, education and communication services were grouped as EEC activities. So let's look at the annual budgets of the selected 4 well-performing centers in 2011. Neovita, the largest center, had an annual budget of 89,000. Annual cost of Atis Center were 32,000, and this was followed by the 2 smaller rural centers, Salve 24,000 and Tineri Pentru Tineri $20,000. So how the centers were financed? Financing structure of the centers was quite fragmented. The centers received funding from several sources. The largest part, 58%, was financed by the National Health Insurance Company. Other sources were external. UNICEF and SDC provided both 12% of the funds. The remaining 18% was funded by family doctors' clinics, which are the host institutions of the youth centers, local authorities, and other sources. This highlights that the 4 well-performing centers rely heavily on external funding, 42%. This raises questions about the financial sustainability of the program. Next, on what the youth centers spend their money. Here are the main expenses categories of the centers. Personnel salaries were by far the largest category, 47%, almost half. The second largest group were operational costs, 19%. Third were personal training costs. Together, these 2 personal related categories, salaries and personal training, cover 64% of the total cost. Information materials were the 4th cost category and accounted for 13%. Medical supplies were the smallest group, 4%. The share of medical supplies was surprisingly low, especially when taking into account that this is a medical program. There are 2 likely reasons for this. Beneficiaries need to pay for the medicines themselves, and secondly, limited procurement of medical supplies to the financial constraints. Let's look next the cost per service. How much did delivering each service cost? In this table we have the combined figures of the 4 centers. First we have the healthcare services. The next column, the cost, is the budget allocated for each service type. Then the services column, which indicate the number of the services provided, and the last column, USD per service, shows the average cost per service. STI consultation cost $5.02. HIV consultations were $10.08. Consultations related to early pregnancy and contraception were $5.11. Other sexual reproductive health services were $3.96. Psychological counseling services were the most expensive, $10.59. This is due to the longer duration of these consultations. General health services were $5.40. Information, education, counseling, communication activities were the lowest cost at $2.55 per person. This is because these services are provided mainly in groups. Average group size was 20 persons. These figures should be interpreted as estimations. Because healthcare consultations are often combinations of services, for example, a pregnancy test and STI consultations. Therefore, these calculations rely on assumptions on budget allocations, number of the services delivered, and context per person. Next, cost per person reached. In order to estimate the cost per person reached, the services were divided into two groups: healthcare services and information, education and communication activities. Cost of providing healthcare services were $12.10 per person, and the cost of providing information, education and communication services was $2.55 per person. How much scaling up a good quality national youth-friendly health services program would cost? At the time of conducting this study, there was no detailed plan how the youth-friendly services will be scaled up in Moldova. I'm sure at this moment the scale-up has progressed much further. In the absence of a detailed scale-up plan, we made a rough estimation on national cost of scaling up a good quality program to all 38 youth centers of Moldova. We did this by extrapolating cost of 3 well-performing centers. The largest center, Neovita, was excluded from the extrapolation because it's a larger size. If all the 38 centers would provide good quality youth-friendly health services, the annual cost of national program would be approximately $1 million per year. The cost analysis have some limitations. Firstly, personnel salaries are the largest part of the total budget. Therefore, the cost results are sensitive to variations of the number of employees and their salaries. Secondly, cost analysis per service and per person reached should be interpreted as estimations because these calculations rely on assumptions on budget allocations, number of services delivered, and contacts per person. Thirdly, budget extrapolation for national scale-up does not take into account of additional resources needed for coordination and training for a larger program. The cost analysis highlighted the following. The well-performing youth centers rely heavily on external funding and voluntary work. The large share of external funding, 42%, raises questions about the financial sustainability of the program. Moreover, many of the activities, for example peer-to-peer education, were carried out by a large group of unsalaried volunteers. Without their voluntary input, the salary cost would be much higher. Cost share of medical supplies was surprisingly low, 4%. This is low especially when taking into account that this is a medical program. And finally, the cost analysis showed that the significant resources would be required for scaling up a good quality national youth-friendly health services program in Moldova. I would like to thank my co-authors, Dr. Evert Ketting and Dr. Qalys.eu, and also the following persons and organizations for their support and inputs during the study. We hope that this cost analysis will contribute to decision-making and implementation process of youth-friendly health services in Moldova and also in other countries planning to implement similar programs. If you need health economic expertise to support planning, fundraising or evaluations of healthcare programs, please get in touch with me. My email address is here. In the second video, we will present exploratory cost effectiveness analysis part of the study. Thank you for watching.